Hi friends. So now let's begin with the approach to unilateral hyperlucent hemithorax. So I have taken two different videos wherein in one we've discussed the approach to a unilateral opaque hemithorax where one side is complete whiteout, and that was relatively simpler. Now we talk about this, which is frequently given to students as a long case, right? So here the beginning will be completely discussing this, which is the unilateral hyperlucent hemithorax. What are the differentials? How do you approach it? So this is what we are beginning with, and then they'll usually give you a CT scan to follow it up with the X-ray, but your main viva will be centered around this. Okay, so this is a very, very important scenario wherein one side of the lung appears blacker than the other. So the first thing is, which side is abnormal? Is it the right side which is blacker, or is it the left side? So let's begin with an exhaustive discussion of how we have to approach it. So if you have this conceptual clarity, then approaching the X-ray becomes very, very easy. So first, I'm going to teach you the concept that when can one side of the lung appear blacker? What are the different possibilities theoretically, right? So first is either the contralateral side is abnormal. It is not the hyperlucent side which is abnormal. Usually it will be the hyperlucent side which is abnormal. But when would it be the contralateral side which is appearing denser? And that is why you have this apparent hyperlucency of the contralateral side. So the first thing is where contralateral side is more opaque. So when would you have this diffuse opacity, diffuse haziness to the other side that makes one side of the lung look blacker? So the first possibility is that you have denser soft tissue on one side. When could this appear? When could this be present? So one, either there is a pectoralis hypertrophy on one side, can be seen in patients, who are going to the gym and maybe one side is been worked out more. So very unusual, but one-sided pectoralis hypertrophy can result in this. Or more likely, more likely clinical possibility is that one side has some abscess or hematoma. So maybe there is a breast abscess or there is a chest wall hematoma, which can result in more X-rays being attenuated on this side, resulting in a hyperlucent lung on the other side. So this is first thing. Apart from that, there could be a pleural effusion on the contralateral side. This is more commonly in a supine X-ray, right? If you have a patient lying supine, the fluid is going to gravitate throughout, which may lead to this haziness on one side. So this is the first possibility. So this is the first possibility. Apart from that, there may be pleural thickening, all right, which is present in one side. All right, so let's have a look at this X-ray here. So to decide which side is abnormal, yes, right side appears more hyperlucent, but that is because of this diffuse haziness on the left side. So this was a case of a pleural effusion where the patient is supine, right? So this is the first consideration that we have to keep here. Then we talk about the technical parameters. So this is, now we are into the zone of ipsilateral abnormality. So now we are first talking about the technical parameters. This is where most of the questions will get asked from. So the first thing that we have to rule out here is the patient rotation. So if the patient is rotated towards right side, we are gonna have the right side appearing hyperlucent. So let's have a look at an X-ray here. So first of all, how do I know whether the X-ray is rotated or not? We have discussed this already. So we look at the spinous processes. If you see that the distance between the medial end of clavicle is increased here, what do I say? I have taught you whichever clavicle is away, that is the side of rotation. So we have learned that whatever side is away, that is the side of rotation. So here I am going to say that the patient is rotated towards the right side, and that is why the right side of the chest appears hyperlucent. A shorter distance of X-ray travels through the patient, and that is why it appears hyperlucent, whereas there is more attenuation on the other side, resulting in a more opaque appearance, right? So there is hyperlucent right-sided hemithorax. In addition, we see that the right mediastinal structures like the SVC start to appear more prominent. So this is the first most common scenario, that you have to rule out, that hyperlucency is because of technical parameters, that is a rotated patient, or you can have other parameters like a lateral decentering of the beam, right? So if the beam is laterally decentered, in that case again you will have hyperlucency on one side. It's something where on the x-ray you see no rotation, rest of the abnormalities have been ruled out. So this is more of a diagnosis of exclusion, more for the theory, more for the answers for the examiners to be impressed. And lastly, you need to rule out scoliosis. Again, scoliosis is a factor which will lead to one lung being hyperlucent. So in this case, you can see how there is a lateral curvature, there is a scoliosis resulting in hyperlucency of one side, right? So you can see how the right hemithorax here appears more hyperlucent. It's because of the scoliosis. So these are the technical parameters that we have ruled out. So two major categories you rule out. First, is the contralateral side more denser, that's why it's looking hyperlucent, or is there technical reasoning to it? If not, now I have to compartmentalize to either that side having less soft tissue which is attenuating the beam and that's why it's appearing hyperlucent. So that's the first scenario, the easiest probably. So first possible DD here is that maybe there is a mastectomy on one side, or a very important case for the exam, there is Poland syndrome. Poland syndrome is where you have associated congenital heart diseases with a chest wall hypertrophy. So you will have pectoralis being absent on one side resulting in hyperlucent hemithorax. So in this case, you can see how the right-sided hemithorax appears blacker here. And when you look at the CT, on the X-ray, it's very difficult to make out why, but when you look at the CT, you can see that the right-sided pectoralis major is hypoplastic. So this is a case of Poland syndrome, which can again lead to hyperlucent hemithorax. If you look at this particular X-ray, you can see how the breast shadow is absent on the left side, leading to left hyperlucent hemithorax. All right, so this is where you can just make out very quickly if the soft tissue is missing or not, and again the history taking is going to be sufficient. Now